How do you put patients at ease?
First and foremost, it's serious, right? What we do is serious. Most things that patients are going through are much harder than any of us will ever be able to understand, especially for them in the moment. But for me as a tech and me as me, it's a smile first. It's make them laugh first. It's make them comfortable first. Then we'll worry about the other stuff, because the other stuff's gonna come regardless whether ready or not, right? But if you just put them at ease and help them feel comfortable first, it makes things a lot easier.
How do you teach that to students that come through?
Demonstration. So first and foremost, if you can't ask someone to do something that you're not going to do yourself, you can't be, oh, grumpy, point your finger, and then expect somebody to act or be a certain way. So lead by example is first and foremost. You know, I show the students continually what I do and how I do it, how I interact. It's not, I can't force someone, you can't teach that, but hopefully if they see it, they see the interaction, they see how the patients appreciate it, they see how the patients reciprocate, it goes a long way, and you see them start to mimic in their own way, and they come out of their shell, and then they have their own interactions, they put their own taste, their own twist on it, right? And it just makes that experience better for them and the patient.
How do you see SDMI embodying the patient experience throughout the organization?
I see it everywhere. I see it in every department, you know, and I try and live up to it right in my own department. And I'll continue that when that transition to CT goes on, but I see it from every level, you know, it's patient first, and just try and deliver that, you know, easy and safe environment for our patients.
Do you have a favorite patient? Or a most memorable patient?
A lot of them are great. Okay, I love working with patients. Otherwise, I wouldn't be doing this. Kids, surprisingly, when I came from a very small clinic, right, and I didn't really deal with children. So coming to SDMI, a whole different aspect that I didn't experience in my career is dealing with peds. I was so scared to deal with peds. Oh, am I going to get everything right as a technique? How am I going to do it? And peds actually are really fun, you know, because they're so scared, they have no idea what they're in for, and you just turn up the lights and you just have fun with them for a minute, and it really changes the entire vibe for the peds, right? And hopefully I don't sound like Olaf on this video, but some of my coworkers say I remind them of Olaf. So I use that a lot to make peds, you know, at ease. They'll be like, I'm scared. I'm like, well, do I remind you of Olaf? Have you watched Frozen? And it turns into a completely different conversation and experience. And to be on the safe side, I'll go with peds. Peds are my favorite.
Okay.
Which, ironically enough, were the patients that I was most nervous about coming.
What do you think is easier, peds patients or adult patients?
Peds patients.
Yeah.
Let me tell you why.
Okay, tell me why.
Because they tend to hold still a little bit better sometimes. It's completely different, you know. Dealing with peds, the complete unknown, especially if it's their first imaging, you get to be part of that. It's like, you know, and they walk past the monitor, they can kind of say, I can't talk about anything, but look, there's your heart. You know what I mean? So, and just the look on their face when you take care of them, and then it's not as bad as they thought. I kind of like to do magic when I'm with them. Our particular room has an auto detent where you push a button and the equipment kind of moves into position, which is pretty rad, by the way. You know, I have a student or I have somebody in the back controlling it, and we'll do magic as the tube moves overhead, just to kind of get the ped involved and get them kind of calm, and it actually works pretty well.